A warm welcome to all our viewers to our series Natural Medicine. Today, it's a great honour for me, and I'm also full of gratitude that a gentleman from Vienna managed to come here. He's a university professor at the Medical University in Vienna. He's Doctor of Mathematics and a Doctor of Medicine, and as a specialist, Doctor Plastic Surgeon. And he came here today to talk to me about light. A warm welcome, dear Kurt Schicho. Thank you for being here. Thanks for having me. As always, it's a pleasure to go to beautiful Switzerland, to Lake Constance, and also to talk about an interesting topic. Yeah, great, because we were completely missing this topic. And to speak about natural medicine as a broadcaster, the light must really not be missing. And I know that there is an incredible amount of scientific studies behind it. Or clinics, such as the University Cantonal Hospital in St. Gallen or Vienna, that already work with it, namely with light pulses. Can you explain to me a little more how light pulses work for pain or for wound healing? Yeah, so that's an important issue, but I'd like to emphasize something in advance, because you mentioned natural medicine, naturopathy. It's very important to me to emphasize that with light, we're not in any way in conflict between so-called academic medicine and alternative complementary medicine. For me, the distinction of therapies is only, do they work or don't they work? And with light, although it's a gentle method, so to speak, gentle, something that's often associated with naturopathy, with complementary medicine, it also applies to light. Nonetheless, everything we do with light here is backed up by studies, and the mechanisms behind it are also very well known. You already mentioned that light has been very widespread, very established in medicine, traditionally and for many decades. On the one hand, for wound healing, on the other hand, for pain therapy. So I just know in the past the canton hospitals also put the patient outside into nature, into fresh air. I also believe because of light and because of the air. But we now actually talk about light therapies. What do the viewers have to imagine? A bit of sunlight or something else? Purely from a physics point of view, there is, of course, different types of light. It differs in wavelength, differs in energy. So we're deeply involved in physics. In medicine, of course, we also speak of the most varied types of light. As you mentioned, in health clinics, when you go out into the fresh air, sun exercises, that's healthy. So we don't need any great science for this, we know that. And even academic medicine doesn't deny that exercise, sun, fresh air is healthy. Sun, of course, only in moderation. But what we're talking about here is light therapy, or low-level light therapy, or low-level LED therapy. And also, as a third term for which this abbreviation stands, low-level laser therapy. That's often a bit mixed up and not clearly differentiated for precisely defined therapeutic purposes. And it's all about using the right light for the respective application. We're talking now, and also our research is currently focused on low-level LED therapy. This is a kind of light which avoids the disadvantages that other types of light have. In other words, avoiding side effects and pain. We're talking about LED, so light-emitting diodes, so normal light sources that work in a wavelength range. It's red light. It's pulsating, so flashing red light. Why? Why this particular wavelength? Why this type of light? Well, at the beginning, there was a cooperation with the Technical University of Vienna, where they initially calculated very theoretically, very scientifically, so really calculated it on paper by forming differential equations, modelling processes and then solving them, and they found out which properties the light must have to penetrate the tissue in the best possible way and to permeate the tissue in the best possible way. And so we got to it strictly scientifically from physics, from the natural science, to achieve the desired properties. The light has to have these wavelengths, frequencies and so on. So it's an infrared light. It's at 660 nanometers in that case. 660. There are different areas that are defined. for different applications. And with this wavelength range, we have, on the one hand, a light that penetrates very deeply into the tissue. This is important because it's not just about the effect. The effect must also reach the destination. So the effect can only occur if the target organ is also reached. And the application, as you already mentioned at the beginning, is typically pain therapy and wound treatment. We are currently working intensively on this. Pain therapy, we have to differentiate again. Is it pain that occurs during exercise, for example? Tennis elbows, shoulder pain when playing golf, joint pain for footballers, skiers. We know this is a common problem in competitive sport, but even more so in ambitious amateur sports, that one often does a bit of overkill in training. So at some point we said at the beginning, exercise in the fresh air is healthy, but at some point it really is overkill. You damage the musculoskeletal system, and unfortunately many then go over to swallowing pain medication so that you can easily continue exercising even though the body says it's too much. And here we have the opportunity with light to fight the pain without harmful side effects that painkillers naturally have, especially if they're used for a long time. So people who are in training, who haven't yet injured themselves, but where the body simply reaches the limits of its capacity, want to keep training, and there we can fight the pain without the harmful side effects of painkillers. And to say it in a colourful way, do something good for the musculoskeletal system, so that the skier, the footballer, the snowboarder, the golfer, the tennis player can continue their training without resorting to painkillers. Okay, so now, so that I understand that too, if this infrared light comes in now and I'm fit and push the limits, now this pain comes and now I add this light in there, is the light then somehow an electron donor? I have to make a small correction for a moment. It's not infrared light that we're working with here. There is, of course, in medicine also the use of infrared light, which is simply a source of heat. So infrared is basically heat. So the transition into the visible spectrum of light, we're talking about heat. There are also certain areas where you simply need heat and then use infrared for it, but we're not talking about that here, because especially in the musculoskeletal system, so if we strain joints a lot during exercise, and the whole thing goes in the direction of an inflammation in the joints, heat could even be counterproductive. Heat could even worsen the symptoms, especially with inflammation. Warming is a sign of inflammation, and if you would add heat, so add infrared, you'd even have an unfavourable influence on the problem. So we're not talking about infrared here, we're really talking about visible red light. Infrared is just heat. This visible red light doesn't give off any heat. No heat, that's very important. But what does it do? It's cold red light, so it's cold because the tissue isn't being warmed, and therefore a worsening of inflammatory reactions is not to be expected. The light penetrates into the tissue, and there are different mechanisms here. That would be way beyond the scope of discussing it, but one of the effects, which is very well described and calculated by mathematical models, is an interaction in the 12-oxoleucotriene B4 metabolism, which is basically about inflammation. So if you look at it scientifically, inflammation is a very complex process. They are a complex interplay of various factors that take place in the body on the cellular level. And here it was modelled very precisely, which effects the light has, which interactions between this light and the processes in the body take place. That simple inflammatory processes can be favourably influenced on the cellular level. And a second point that is extremely important is the effect on tissue perfusion, so the blood flow in the tissue. And that's really interesting. We made studies very intensively, also in cooperation with my colleague Dr. Peter Dungel from the Ludwig Boltzmann Institute. He'll come here too, I've heard. Exactly, for experimental and clinical traumatology, who has dealt with it intensively. So blood flow in the sense that, on the one hand, It has been proven, and that's really important to me to emphasize, it has been proven in the laboratory, in control studies, that light causes the stimulation of new vessel formation. This means that the factors that lead to the formation of capillaries are favoured by this light. There are very interesting experiments there, and that's what I like very much about light as a scientist. I mean, I'm not just a plastic surgeon, my specialty is biomedical technology. That's where I did my habilitation. I like this continuity that, on the one hand, we can really model something. We can take a piece of paper and can use differential equations to model what happens here. And then we can go to the laboratory, we can verify things in a laboratory test, and then we can, and we did that too, go to the patient and actually clinically determine the effect. The pain becomes less, the wound healing improves. So a continuity, not something that works because you believe in it. Especially with pain, we know that the psychological component is extremely important, and is also absolutely justified in medicine, and should also be encouraged. Care, time for the patient, attention, empathy, that's all important, it affects the pain. With light, however, perhaps there is quantum physics too, the observer effect. Quantum physics is not my specialty, so I'm not a proven expert on it. But at least here with the light, we can actually, in control studies, demonstrate an effect that is definitely not explained by empathy, affection, so the imagination, so to speak. That is very, very important. For example, we've published experiments in the literature where we used, a plastic surgeon would say a rag. This is just a tissue area, a piece of skin with a tissue underneath. Has been separated from the blood supply in a defined way. Restriction of the blood flow in a tissue area performed in a precisely defined way. And here we are able to demonstrate, so my colleague Dungal and his group, that through the use of this pulsating cold red light, in this case it was the repulse radiator, this is a device that emits this radiation, a significant, really significant improvement of tissue perfusion has been caused. So, to put it very clearly, we separate this piece of tissue from the blood circulation, and the consequence is that the tissue dies and becomes necrotic. If one applies light, the damage caused by this reduced blood flow can be significantly reduced. This means that the tissue survives much better. A colleague of mine, a dentist, uses that in her practice. So really after dental surgery treatments, she uses pulsating red light, just like you say, to improve wound healing and to increase blood flow through the tissue again. Yeah, and the nice thing about it is because the pain perception, the sensitivity to pain, is something deeply individual. So one and the same injury or a pain stimulus is subjectively perceived very differently. So if we both fall now or hurt ourselves, whatever, we may feel completely differently. The men would say 10, the women would say 4. There are people who aren't sensitive to pain at all. They're brave, that's individual. We have now, may I mention that because this is really an interesting study too, my colleagues from the Medical University of Graz, a study design where medicinally, so with special plasters, a precisely defined area of skin was irritated on the left and right forearms in the same way, in a precisely defined way. Same size here and here. An area on the skin was made hypersensitive. That means that lukewarm water is felt to be lukewarm everywhere. And in this spot it feels like an iron, a hot one, and cool feels cool everywhere, and in this spot it feels like an ice cube. Really painful. And then, blindfolded, under controlled conditions, one of the two sides, at random, was treated with light for 15 minutes. The patient didn't know which side. And then, fully automatically, without human intervention, without communication, without verbal interaction, a computer system tested the pain threshold on both sides. So just change the temperature. And the subjects have... Now I'm excited about the results. Given feedback when they felt the change and when it was painful, so when it's ouch, and when do they feel the change, and then, as I said, without human communication, it has been tested fully automatically, randomized, controlled, and in this case, for the first time, really independent of the individual capacity for suffering. Regardless of whether you are more or less sensitive to pain, both arms are irritated in the same way, and only one of them has been treated with light. So the difference is really only due to the light. And we were completely surprised. How big was the difference? Significantly already in the context of a pilot study. So the effect was really so clear that there was already a significant difference within a pilot study. And what will be of particular interest to medical professionals, not only for thermal stimuli, so for temperature differences for heat, but also for mechanical stimuli. This is interesting information for medical professionals, because mechanical irritation and thermal irritation can be based on different pain mechanisms. Therefore, it's very important. So we've tested both the sensitivity in a defined way for mechanical stimulus, as well as sensitivity to thermal stimulus. And both legs, so to speak, both mechanisms could significantly, statistically significantly, prove the effect of light in a controlled study. And that's really one thing where you can see that pain relief, consequently, is not an imagination. Great. Now let's stay with the subject of pain. Our viewers, they also have one or the other ailment. Some have toothache, others have joint pain, hip pain, back pain. Would that mean that you can reduce this sensation of pain with such light pulses? Absolutely, that's the goal, exactly. So you don't have to go to the clinic in Vienna or St. Gallen. Absolutely not. These are devices that are also for sale currently because of the extremely strict medical device rules that apply in Europe. Thankfully, I'm saying that now as a scientist and a representative of academic medicine. Thankfully, the regulations are so strict that not everyone can bring any medical device onto the market, and just does some good marketing and maybe even thereby endangers people or arouses false expectations. The company Repulse, with whom we also conduct research projects, is the only one who has this strict medical device approval. So it has a CE certificate. So this is not a wellness device, this isn't hocus pocus. It's a certified medical product approved in accordance with the new strict regulations in the EU. And that can be easily bought, rented and used. That means that people who regularly have to take pain pills so that they'll get through the day and also through the night would have the chance to work with such systems to treat themselves and then perhaps even get rid of these painkillers. Well, very important, of course, as a physician. I have to add, of course, that whenever you are in pain, pain is an important alarm signal and sometimes also a security for life. Of course, a medical consultation is needed for a clarification of the pain, the cause of pain. So, by no means, if something hurts, they should just take the light without going to the doctor. It's essential to first have a doctor's clarification of the pain. But, as you say, when there is chronic pain, for example, or also pain after surgery, pain after an injury, pain after exercise, the goal is, of course, and it's absolutely sensible and to advocate from a medical point of view, instead of the constant use of painkillers, to use the light. This is a good advice because, for example, my wife has had an accident. She broke her hand several times. There's hardly a night where she can sleep. That would, of course, also be great to reduce the sensation of pain. She can sleep better. Then, of course, the path to health is much better when the body's fit. You have to say, especially when there is pain in the musculoskeletal system, tension, strains, breaking through the pain is very important, because you can easily imagine when one is plagued by pain, one automatically adopts an unnatural posture. But this in turn increases the cause of the pain. Once you break that, that is good. Now, of course, because the hand is always like that, she always has back pain. So now we should also treat the back with light impulses. Exactly. And there's a very classic area of application for a pulse. That's where the company actually comes from. Physiotherapy, rehabilitation. So I can really recommend to see a physiotherapist, physicians for physical medicine, trauma surgeons, orthopedists. So if there is joint pain, it is essential to see a doctor for clarification. And then in therapy, and this is becoming more and more popular, the use of light. It was very important that we don't forget it either. Pain is not only related to the musculoskeletal system with things that we've just mentioned, but pain is a very big issue in connection with wounds. I know, I already thought about this topic earlier. We will please do that in the next episode. Because of the airtime, I think the pain topic is still so important. Sure, I know as a doctor you have to give the risk warning, go to a doctor, clarify and so on, but there are always such little pain problems, headache, backache, lumbago again and so on. Always running to the doctor for such little things isn't good either, but here I can treat myself with my medicine cabinet, such as a light pulse radiator. Absolutely. So once again, really, that is my very big concern. Always only after a medical examination. Never dismiss a headache. It's just a headache. Always clarify. And then to use the light for the treatment, the medicine cabinet, I like that a lot, but it's not a drug, it's a radiator. Looks like a shower head. And the good thing is it actually cannot do any harm. There are a few contraindications, so it's obvious if someone is epileptic, is prone to or has had epileptic seizures, simply because it has nothing to do with light as such, but with the blinking, this flashing of light could be a risk, therefore not for epileptics, for example. That is very important, and that is what defines a medical device. The consultation beforehand. So this isn't just ordered and just do it and try it, but it must first be clarified with a doctor. Information has to be given, and then, however, just as you say, you can have that at home. It can also be used basically in the family. For example, one has it for neck pain against tension, because they always sit in the office for a long time, and thus have this typical tension pain. The other is a recreational athlete and goes mountain biking every 3 minutes or golfing, has corresponding joint complaints. And there you can actually, as you say, medicine cabinet. I like the term very much. Say, I have this at home. One uses it for neck tension, the other uses it for joint problems. And then also, we'll talk about that separately. Someone who has a diabetic chronic wound or has recently had an operation or a burn wound with the iron, which may not require an inpatient stay now, but is painful. You can simply use it instead of just taking a painkiller. Sunburn. It will ease sunburn. Only I would say from a medical point of view, sunburn should rather be avoided anyway. Of course, sure. Now, joint pain. Sometimes it's signs of wear, or if the plates really rub against each other and cause the pain, be it on the hips or, for example, in the knee. Would it be possible, with such pulsating light, to have an effect even here? Yeah, but here again it's a prime example of why a medical examination is necessary. Because if, as you mentioned, the cause is, for example, a plate is osteosynthesis material, or, for example, when the articular cartilage is worn off and bone rubs against bone, we're confronted here with a medical device and not with a miracle healing device. So, when a plate is really pressing against a nerve somewhere, or articular cartilage is worn off, then of course the light will not be able to solve the problem. What the light can do is, in the course of the therapy, so if the osteosynthesis material is removed, if for example an artificial joint has to be installed, whatever is necessary, then the therapy, the operation, is associated with pain, with swelling, with wound healing, and here to reduce the pain, to reduce the swelling, to promote wound healing, the light is ideally suited for. But don't just say that your knee hurts. I'll take the light now. That would be the wrong way. So first, clarify why the knee hurts. If it's just overuse and swelling caused by it, then it will be an ideal therapy option. But if it is necessary to install a knee endoprosthesis, hip prosthesis, of course, the light cannot replace the surgery here. Dear Kurt, thank you very much for this first episode. We absolutely have to talk about wound healing. We'll do that right afterwards. Thank you very much for this valuable information in the field of light. I know that there is still so much you can say, but our airtime is up again. But we'll stay tuned. And also for you, dear viewers. Talking about light sounds strange, but there is an incredible effect here in the area of red light. In pulsed form. I think it's like a laser. It's not a laser. The laser also has unpleasant effects. In some cases it has a great justification in many areas too, but also unpleasant effects. And especially for this home application, we avoid these unpleasant effects by using LEDs. But every dentist should have it almost as a duty, right? The dental area, to finally accommodate that, is a very, very large area where there are also many publications in the specialist literature have appeared in recent years. So with teeth, it's always the swelling. Big cheek, that's just the area where the swelling is particularly bothering in the face. During facial surgery, swelling, pain. Here in particular, the reduction of the swelling is a very valuable means to increase patient comfort. Great. Professor, Dr. Kurt Schicho, thank you very much, and you too, dear viewers. Thank you for watching, and see you next time.